I apologize first, say this so nature you never command, you never control them. Wind day, now you wanna hear noise back. I don't know if it stop the wind, you see so me wanna just listen. Don't care about the noise where microphone they make when I win the cause. Okay. If I be no, I for go see doctor. If I be no, I for see better. Well, we also be say, any man way the ask-docta, he get better chance for improve your health. When sick come, you know they can't get done for morning time, tell you say time don't reach, make you do anything. So you see now how that emergency doctor go pass my back. Someone don't call for ask-docta. That way they could have to go take emergency doctor. So let's have a background. Now alarm where they don't jam, say make someone a doctor. So emergency doctor now they come go. If you listen, smart and they will make tattoo tata. But make we continue for palaver for ask-docta. Cancer, I think we the worry man. Cancer, now sick way if you go for doctor, if you follow up for prevent fine, you feel avoid them or if you manage them. Forget cancer, no mean I say die don't come, but die if you come if you do something. So make my open ear, make we listen for what way our colleague Dr. Ivo Tala Azeh for Terry. So when I welcome for ask-docta.
So, una welcome for ask-docta. So, we don't know now what the cause cancer. So, what the ask-docta fit still tell we now about cancer. I believe so we fit still tell una how you fit know so you get cancer. Cancer no be something where if you get them, when na magic, where it just enter your skin. It cause you die. Sometimes they way some cancer then they way it enter. It there for some position where it be difficult for we for ever know so you begin a cancer. That kind of situation then they. But for plenty cancer then they, if you go for examination, they feel probably find most of that cancer they treat you. But now how man they know say now this way man gets on cancer. When we get any small problem inside our body, we start get small problem then for day. We start get fever, we know the feel fine. We get plenty problem then what they call them signs them or symptoms then. All these symptoms the way they plenty so when we know where. If it be cancer, if it be a different thing. The most important thing I say when you know where. You get to first go see doctor. And when you go see doctor, when he don't look the first symptoms the way you get, he examine you. Now that combination for the kind of symptoms the way you get and which way doctor find out. Maybe he go then talk to me, you do some other tests them before they can know say na cancer. But you know if you just get some small system or say your belly the bite, then a belly cancer. You know if you talk so. But most of the time, if some man get some kind symptoms the way it will not look and so you don't sick so, the most important thing I say may go see doctor. For the symptoms the way you get, and then which way doctor examine for your body is here. Sometimes doctor will say he need for go do na that X-ray where they do am so, and then if you see better whether something no some problem there. If X-ray, fit show we wetin na the problem, maybe they go do that other examination where they take that gel, put am for your skin so, and then they look at inside that machine, where they call am so na ultrasound. Even sometimes with ultrasound, we no fit still see am. Maybe they go doing a scanner, computer tomography as they talk. That one na some new exam, but now so it's there, dey for plenty town them. If you do this one, so where they go put you inside scanner, and then they see how inside your body dey, whether tumor or cancer dey. Sometimes then they say way maybe they get to open your skin before they fit see wetin wey e dey inside, whether na cancer, wey surgeon go operate you. Plenty time then for plenty people then now after they don operate them, before they see and say na cancer be dey. Even if they see that thing wey one day like cancer so, they still get to first take some specimen, just as I be the show now before. Say if then na cancer wey dey some place, just because you see something wey dey so, wey grow dey so inside my belly or for some other organ, e never still mean say that growth dey so na that cancer wey e dangerous so. They still get to cut some small part for that growth, and then they go give am for pathologist. Pathologist na man that way, he go look that, he go take that small part then when they don't move am, so he look am under microscope. He do some tests then for know say that cells then when they dey inside that growth so na true cancer. Because sometimes then dey wey plenty people them, just as we dey talk so, if you look your skin, you go see some small thing the way they hang, the way they just grow, so it no mean say you get na cancer. Now the same thing way they must look that cells for know whether na really cancer. Because something fit grow too so still big so inside your skin will no be cancer. So now when pathologist, as they call it, that doctor way if they look na only that cells them so, when he don't look am, he talk say the one day so na cancer. Then na the real confirmation that say you get cancer. Ask-docta. So as we don't hear now so say cancer dey, people then they die cancer. When they don't diagnose cancer, wetin dey fit do? When ask-docta for the next program then, we go take each cancer wey belong talk so, say then dey different type. Ask-docta go tell una how they treat that particular cancer. But for this program today so, I just want tell una na just say una know this different kind of treatment wey dey. We no go into big book how they do that treatment, but I just say una know wetin they fit do when man get cancer. As we talk say the most important thing so when cancer dey, na say make dem cut and move am. But for cut and move am, na only surgeon fit talk whether if he cut and move am. If surgeon talk say that cancer still dey for stage where if he cut and move am, and then dem cut and move am, then na some big part that way they don't do for the operation. But if cancer, as we be talk saying, na some bad cells in way they just grow, come out for one organ, go for the other organ. If cancer don't come out, go for plenty organ, then they for bone. Most of the time, no make sense me surgeon operate for one place, move that one because the other one is still there. It depends now for that particular situation whether they get to cut them or not. So other method they we don't hear, as we hear to say, that's a new method. Now say they use something that they call them say radiation therapy. Yeah, as I be talk so say some other method they way they use now radiation therapy. That radiation therapy just dey like some gun way, na some light it dey comot dey. When they hold and put am on now, and then they put am for that place where that cancer dey, it burn that cancer too, and then it kill that cells them. That's on one method that, but there's some big machine where it there plenty too. It then are only for the whole country, then are only for Yaoundé and Douala. Another therapy we don't hear about treatment na chemotherapy. Chemotherapy na just some name for plenty medicine them. No be one medicine. Chemotherapy na the drugs them where they give them for cancer before. But that drugs they don't plenty now, plenty. No be all them be chemotherapy. Then they win a tablet where if you take them. Then they too win a infusion where they go put them for your skin and go inside your body. When you go inside your body, it kill plenty cancer cells them. But if you kill two normal cells them, now why that it cause plenty when person take them it is sick more plenty because the side effects them is plenty too. Another group for medicine they will get, we call them now anti-hormone therapy. Because with hormone then they so inside our body, they cause cancer too. Some of the cancer they will get, for example, for breast for women them, or prostate for men them. That their cancer it grow when hormone them inside our body it reach that cells them. So they give you some drug, some tablet, when they call an anti-hormone therapy. When they go inside that cells them, it block them. May hormone the inside our body may not reach that cells they made it grow plenty. So now they call an anti-hormone therapy. For other country them, some new drugs then they don't come now way it even work fine. It work fine past chemotherapy. That drugs them there they cause them targeted therapy, or they call them biological therapy. Now because plenty people the way they don't learn big book, they don't understand how cancer they function. They don't go look how that cancer cell dey. And then they develop some drug where they shoot up. When they go inside your system, they go find only that cancer cell. It hang on top, and then your immune system kill them. Just as you take gun, so you time some particular thing, you shoot them, and then you kill them. Now, so that drugs then they work. Now, why that they call them say target? Because they don't design that drug. They look that cancer cell, see that cancer cell, it then so it gets something for a head. And then they make that drug to way that thing, it go enter directly for that head, for that cancer cell. So that they give them now inside your system, it go work there. Now new drugs them way then they plenty of them not there for the whole country, but then they for plenty country then way if man gets the money, if he buy it. And then sometimes then they too for cancer now when the cancer long reach some stage, we no fit still cure. Maybe we just get to give and medicine them way it make ya may you know they suffer plenty. We call that one then a supportive therapy. So that may person will get that cancer where they no fit treat them again, but may they live some life like human being, may not they get pains, may not they vomit plenty. They call that one then a plenty drugs and they call them supportive therapy. So now the different kind possibilities and that way they fit treat cancer. So, mommy and papa them, una welcome for Ask Doctor. This part for cancer wey Ask Doctor wan tell una today, so na the most important one. So una open una ear them fine, because na the only way that so wey you fit try say maybe if you get luck, that cancer no go meet up you with all your trouble them. And this part na how for prevent say make you no get cancer. Because plenty sick dem dey, so we fit treat am, so we fit treat am. So we don hear for cancer say the sick bad too much, it cause problem dem, plenty people dem dey die. The drugs dem and the treatment dem, they no even dey for country. So wetin you fit do say make you no get cancer na the number one. Prevention is better than cure. Okay. So Ask Doctor wan tell una today, number one for prevent make you no get cancer na say make you take care of your health. So for take care of your health, you dey start by taking care of wetin wey you chop. As we be talk say chop wey don spoil, so e no dey only taste fine, but e dey bring cancer too. When you dey chop wey e don form mold, wey mold dey inside, throway am. That money wey you dey wan save, so you go come pay am after 10 times. If you take groundnut wey mold dey there or corn, throway am, because you fit can get sick. Lifestyle, the way we dey live, e dey important. People dem wey their body dey fine, strong, wey dem dey waka plenty, they no dey get cancer plenty. So if you look the way your mommy be dey waka, go for farm every day 5 kilometers. Even your farm no dey 5 kilometers. Waka every day. Go waka for bush, do small thing them. That waka wey dey waka, so it dey make your body strong. It dey make your immune system strong. It dey make you no fat, because fat people then get cancer plenty pass people the way they get normal body weight. So keep your body strong. Do physical work. The one so na for people the way they work for office them, where they sit down plenty like driver them. People the way they over chop fat, over puff with oil. When you over get weight, you dey over get cancer. We don't talk about all that fine thing them wey we think say na fine things wey they can cause cancer. For smoke cigarette, all that smoke, so avoid them. If you dey smoke today, you start to reduce your amount of cigarette wey you smoke every day. Give yourself target. Say maybe next year I no want smoke again. You know save your health. Now the same problem with alcohol. Alcohol, whether na for wine or beer, e no bad. Now when e don over plenty, we na problem. You dey for small society, you drink your one beer, you drink your wine small, e no bad. But if you can't reach na stage where na every day you need, when you discover say you need alcohol for function, then you don't reach na dangerous stage. You leave that one too.
Smartcast to go. www.smartcast2go.com. If you go holiday for Cameroon, you need motor will be reliable. Go for www.smartcast2go.com. www.smartcast2go.com. It's there for Douala.
As we be the talk, one important way for lifestyle, where it cause problem. It not only cause problem inside house, but it cause problem inside we body too. Now problem for promiscuity. As we be here, promiscuity na that big term where they use them for people them way, then they go sleep for the house today with this man or with this woman. The next day they live for that house with that man, with that woman. Then they sleep with each other, or they get sex with each other where they no protect themselves. And through this sexual contact, then when they get so that they transmit germs then, where they cause sick. And as we be here, say plenty of that sick them, starting for woman, the cervical cancer where it be caused by virus. If woman will get that virus, man feel carry that virus, it could give the other woman too. Or the man will belong carry am for some other woman, it go give am for the next woman. The next other virus we'll be talk about too na virus where they cause hepatitis, when inflammation of liver. That virus too, it be transmitted by sexual intercourse, and it lead to liver cell cancer. And the big one too will belong here where una the hear every day for radio, for TV na HIV. Where HIV, you know, the virus no the only cause HIV. When you get HIV, you fit get plenty other cancer there. So all these sick them so it be caused by promiscuity. So if I say may people they may they stick to the same partner where they get for prevent transmission of these germs them, or may they use systems them within the way it prevent that infection them, like condom them. Ask-docta. Ask-docta. So some other thing then they too if you do them for know whether you get cancer or not, or for prevent cancer, because cancer they so it develop. Maybe sometime the way you get some changes then for your system where doctor feel see them, it treat you. Where if they not treat them for that stage, it go lead to cancer. So if you get problem then for your body, it be important to me go see doctor, because when you don't see that stage then they so if you still cure them. One way we know plenty now for women the way we get to do with that cervical cancer, as we talk so. We get plenty program them for women them where if you go examine yourself, when they examine and they take specimen, look whether some small changes they don't do for that organ where if it lead to cancer, then they treat them before. Sometimes they said they already operate part of that organ, move them, so that make cancer not develop. So this program then they for plenty center them. So if you find out around you for know which center be in charge of you, if you go for that program. We dey call that program the National Cancer Prevention Program, where it dey for country. We get prevention program for cervical cancer. As we be talk to say age dey cause cancer. When you don't reach some particular age, you find say make you go frequently for your doctor, may they examine you. For women then when they don't pass age for 40, they dey for risk for get breast cancer. Then you go see your gynecologist regularly, and then he go tell you how often you get to come for examination. The same thing too for men them, because prostate cancer too is plenty for society, and men them above age of 42, they always get to go. If you get urologist where you know it, if they examine you, you go there. If you not get urologist, you get doctor where they for on a corner. When I go, he go still examine you. So we'll see, and so we'll get plenty possibilities then. Even for women then, particularly for breast cancer, because their breast na organ where if you examine them. Cancer, as we be talk, na growth where they grow. So when you get to nodule for your system, nothing where they get to rule out, where they get to examine, say no be cancer. So for women then too, particularly for women them, for their breast, they get some possibility where they fit examine their breast, both sides and under their arm them for know whether changes then they changes then they say it no mean say it must be a cancer, but if it be. So for women them, they get some standard and way they fit explain for each woman how to examine itself. If you can't notice say something there inside, then he go see doctor, may they examine further. So as ask-docta, the most important thing we do now for prevent cancer, and we don't tell una possibilities then we do for prevent cancer. We thank una plenty.